Sometimes we test people with the differential diagnosis of what we call the usual suspects. The usual suspects means that the tests that we're doing are for conditions that could mimic anything. And so in medicine, there are mimickers and masqueraders. And so these mimickers and masqueraders are what we call the usual suspects. So in the infection realm, the thing that can mimic any disease and any ophthalmologic finding is syphilis. That's why syphilis is sometimes called the great mimicker or the great masquerader. Tuberculosis, likewise, can be a great mimicker and can do anything. So these two, you will never go wrong by having these two in the differential diagnosis. And therefore, any patient who has a neuro-ophthalmic problem, we should be testing for syphilis, and we should be considering tuberculosis if they're from an endemic area, have traveled to an endemic area, or they're in the high-risk populations. The high-risk populations, homeless people, jail, and ironically, healthcare workers. That's why they test you every single year if you're a doctor, even though you have no symptoms, because you've been exposed to so many tuberculosis patients. They want to make sure you don't have TB. On the inflammation side, the great mimicker is sarcoidosis. Sarcoidosis. So sarcoid, syphilis, tuberculosis, these are the mimickers, infectious and inflammatory. And on the neoplastic side of the differential, the great mimicker is lymphoma. So when I say round up the usual suspects to my residents, what I mean is testing for infections, syphilis, tuberculosis, inflammations, sarcoidosis, and if there's a mass lesion, we can always be lymphoma. So sometimes we just say it all in one word, SSTL, which is syphilis, sarcoid, tuberculosis, lymphoma. It's just like one word, SSTL. These are the usual suspects.